All right, it is 4 o'clock, time that we give our update Monday through Thursday, go through a few items we're working on in state government and provide our COVID update. So today I'm supporting education just in a slightly different way. This is the Paul Sawyer Public Library here in Frankfort. This is them doing their part to make sure that their employees are safe and that also those who visit the library are too. Our library still serves such an integral purpose all over the Commonwealth, whether it is providing books for some kids that might not otherwise have a chance to open them, providing a space for people to come together when we can, or providing internet access when sometimes it's difficult. We appreciate our libraries, and while we know their mission may be a little bit different than they were when I was growing up, we know how critical they are to their communities. So thank you to the Paul Sawyer Library. In full disclosure, my wife also read in a digital platform there just the other day, so I'm supporting her too. All right, we have a very fast at 4 today. A couple of major things going on. Today is National Voter Registration Day, which ought to remind everyone to register to vote and then to make sure to vote. Again, you have more opportunities to vote now than ever, certainly in my lifetime, I think in the history of Kentucky. So we ought to be able to set a turnout record this year. Deadline to register is coming up. It's October the 5th. If you've moved to Kentucky, you've never registered before, you've turned 18, or you have had your voting rights restored in that you have done your time for a nonviolent, non-sexual felony, you can register to vote by October 5th, and you should. Voting is a bedrock part of our democracy, and I think it's something that gives us dignity. And so let's make sure we are doing it. Request your absentee ballot. If you are in any of the danger areas for COVID, age, or have a pre-existing health condition, if you are just really worried about it, if you live with someone with a pre-existing health condition, if you have a lot of contacts in your day, request that absentee ballot. I've done it. I think about 400,000 Kentuckians have done it. Please make sure you do that. If you are not going to vote absentee, vote early. There are 3 weeks of in-person early voting beginning October 13th. If you choose a time and you make a plan for one of those days, it spreads out when people are in that polling place. And we need to make sure that the vast majority of people vote early and not just on election day, though there will be multiple locations in most all counties. There'll be a couple counties that just have a handful normally that might just have one. So National Voter Registration Day, take advantage of it. Make sure that you have the ability to vote by registering and then actually vote. I've learned since I've been governor, though probably before, that everybody's got an opinion. So if you do, and I know you do, make sure that you exercise that right to vote. Number 2, I'm going to continue to say this, get your flu shot. It is absolutely critical going into this fall that we have our flu shots. I got mine just the other day. It really doesn't hurt. It protects you. If you've ever had the flu, you really don't want it again. And with these vaccines being pretty effective, certainly cuts down on your risk. This is Dr. Stack. He's getting a little time off, so I won't tell you whether he cried or not after this one. But this is the Lieutenant Governor. Again, get your flu shot. Perfectly safe to do it. Protects you and is really important in a time of COVID. And here is Virginia, who's not with us today, but is still with us, isn't she? All right, next is student aid, which when we look at post-COVID, what we were working on before COVID, what limits us and what truly helps us get ahead? Well, the education and the health of our people are primary. And with student aid and the opportunity to have state scholarships out there, to make higher education especially more available to everybody, knowing that every first-generation college graduate changes every generation after them, changes the history of their family, going backwards and forwards. We want to see more kids take advantage of this. So in July, I announced an additional $15.3 million in need-based financial aid to students made possible through the Kentucky Lottery proceeds, Kentucky Lottery, having a brand new CEO. These dollars will fund up to 7,500 new awards to college-age students whose families are struggling as a result of this pandemic. 7,500 kids whose families can get help. We want Kentucky students to be preparing for their futures right now, whether that's college or advanced training, so when we emerge from the pandemic, they'll be ready to take advantage of opportunities awaiting them. And we want every Kentucky student to access federal and state assistance available to the greatest extent possible. If you are in school and experiencing financial difficulty, contact your school's financial aid office. They can help reassess your financial need, which could result in your aid being increased or maybe getting aid for the first time. You can also contact KHEAA, KIA, the Kentucky Higher Education Assistance Authority at kheaa.com or 1-800-928-8926 for questions or learning how to apply. This organization administers the state scholarship and grant programs in 2020. This fiscal year, thanks to proceeds from the Kentucky Lottery, more than $272 million in state scholarships and grants were awarded to Kentucky college students. $272 million, trying to create better lives, better opportunities, better education for our next generation. And through the use of technology, KHEAA, KIA outreach counselors continue to work with students, families, and adults across the Commonwealth to assist with college readiness and provide assistance filing changes to the FAFSA. Through social media, they're connecting with school counselors, students, teachers, and other interested parties. And their sister agency, the Kentucky Higher Education Student Loan Corporation, is Kentucky's only source for state-based, fixed interest rate, competitive private education loans. Loans administered to help Kentucky students afford college when an unmet need still exists after all scholarships and grants have been exhausted is done by KHESLC, or KESLC. We have to have an acronym for everything. They've assisted thousands of borrowers with financial hardships and are doing great work. So for more information, go there. But here's what it is. If you are pushing for that higher education, if you're struggling to make ends meet, if COVID's changed your financial information, there's more money out there to help make sure you don't have to pause your educational attainment. So please take advantage of it. And finally, in our Fast Four, this is National Recovery Month. National Recovery Month is held every September to promote and to support new evidence-based treatment and recovery practices, the emergence of strong and proud recovery communities, and the dedicated service of providers and community members across the nation who make recovery possible in its various forms. You meet some of the hardworking folks in recovery, many of them having gone through it themselves, dedicating their lives to help other people, and you see a little bit of God's grace right there. The Kentucky Office of Drug Control Policy stated that roughly 22 million people in the U.S. are in recovery as of today. That's 22 million of our brothers and sisters across this country in recovery. The Kentucky Chamber started the Opioid Response Program for businesses, launched in June of 2019, in response to Kentucky's employers struggling to navigate the issue of workforce participation in overdose deaths. One special story, though I will tell you, I personally know a lot of special stories of people who have overcome something so powerful and difficult, it's hard for me to comprehend, but have put their lives back together, have brought their families back together, kids back in their home that haven't lived with them for so long. It just shows you that so much is possible, even if it's hard, and we can do so much good work when we're willing to provide people the help that they need when they're willing and in the form that they need it, and to not give up on people. But one special story is that of Rob Perez, owner of DV8 Kitchen in Lexington, where all of his employees are in recovery. Rob shared his business has seen huge success, including a turnover rate that is 1/3 better than the national average. He has longer tenure of employees, and DV8 was named the 40th best restaurants in America. Another story is from Jamie Johnson, Director of Operations at Dorman Products. Dorman has seen an 80% drop in workers' compensation claims, favorable reactions from customers and the communities they serve, and huge growth in the company thanks to the company's Fair Chance employment efforts. It's important we celebrate recovery and increase awareness and understanding of mental and substance abuse disorders through opportunities such as these in Kentucky. And while we haven't talked about it as much, battling this epidemic and protecting and helping those that need help, it's one of the most critical missions we can have as a Commonwealth, and you bet we are going to be just as focused as ever during this crisis, but also coming out of it knowing that it's made it harder for many in recovery to get what they need and to successfully get in recovery and then stay in recovery. All right, let's move to our COVID update. The tough news is tough news for us as a country. We've now lost 200,000 Americans to the coronavirus. 200,000. It's difficult to comprehend that this virus that pretty much didn't exist, or to our knowledge, until the beginning of this year, in really a period of about 6 months when most of these deaths occurred, would take 200,000 Americans. And I certainly don't have another event, period, challenge in my lifetime where we have lost so many Americans. And I can't think of one in the past that occurred that some people denied. This virus is deadly, it's real, and it is harming, killing us. And on a day where we've lost 200,000, and some numbers are going up, we had a large number of cases nationwide yesterday. It looks like cases are back on the rise. It'll take a little bit of time to see. But we got to understand our fight is still going on. It's going to take as long as it takes. It's going to be difficult. But the fact that we've already lost 200,000 people ought to tell you how powerful this virus is and make us commit to doing the right things to defeat it. 200,000. And we've only got a couple Kentucky cities that are larger than 200,000. It's larger, to my knowledge, than any football stadium that's out there, almost double what you'd see. And we've lost those Americans. In Kentucky, we're now 1,119 and growing because of the number of cases that we have. This is a major challenge of our lifetimes, and we're going to be judged in many ways. We're going to be judged in part by how many Kentuckians and how many Americans we let die. And I say that because while we can't save everybody, COVID's that difficult. We can save a lot of people. Wear a mask, social distance, follow the rules that are out there. Don't try to find a way around them. If you see a crowd that's gathered, don't go to it. And if you don't think it'll harm somebody, there's 200,000 families out there in this country that'll prove you wrong. And we see it every day. We see families going through the toughest of the tough and saying, if I could only let people know one thing, it's that COVID is real and you need to wear a mask. How many people have to tell that story over a loved one's deathbed until we all realize that even though we're tired and even though there's something called COVID fatigue, I think that's a new phrase, virus doesn't care. And we ought to be better, we ought to be stronger, and we ought to be more committed than that. While I think at the beginning of the year we're going to be seeing a deployment of a vaccine, and we're still waiting on seeing on how that'll come out, folks, it's going to take as long as it's going to take. And that's the truth, because if we quit, those deaths go up. So let's know what we're facing, and let's just make sure we do what it takes to defeat it. Yesterday, we showed our incident map and how it has been updated today. Again, this is us trying to be in full transparency, showing you all the data that's out there. We want to show you the new White House report. The White House report now, and maybe they're watching what we do, have red, orange, and yellow counties in the reports they put out, and so it'll be posted online. Can you go to the White House counties, James? So here is an example of counties that for this week the White House has in the red zone. Notice they're a little bit different than our incidents. They're calculated differently, but it ought to tell you that we're trying to put together a really fair system that's out there, in that the White House would have more counties in the red zone. We see a lot of counties there that we haven't seen in the red zone before, and it just shows you how quickly this can spread and how flexible and fluid we have to be. Right? If this was a battle, the battle moves to a different area. We've got to be willing to move to a different area and counter and react, and that's exactly what we have to do in the virus. So Warren County is maybe the only county that has been in the red every single report since they first started putting them out, and is still there. Christian, which we got a lot of cases in today. Barron, Logan, Jackson, Grayson, Greene, Taylor, Trigg, Monroe, Estill, Russell, Clay, Caldwell, Meade, Allen, Letcher, all over the Commonwealth. This is the red zone, which the White House views as critical and widespread community spread. And there is now the orange zone. And these are, again, some counties that we had previously seen in red or in yellow. You now see them moving more into the orange area. You see Jefferson there, Davis, Hardin, Oldham, and the list is in the document posted on the website. And then finally, you have the yellow, which is another group of counties. And then finally, there's the green, which is anybody that's not on those. This is up at kycovid19.ky.gov. Again, this is us showing you what the White House believes based on their data. I do think it's pretty interesting that we've got our incident map and have the 4 different colors, and now they do too. And so people can look on there and they can compare, but I think what it says is when our incident map has you in red, it means you're in a difficult place and you need to take the appropriate steps. I want to mention sports real quickly. We ought to be very carefully watching what's going on in our high school sports. I think we have at least 5 football teams right now that are quarantined, that aren't playing, including 2 teams that just recently played each other. We need to see what happens there, and the number of positives, at least on one team, continues to go up. We need to know that when we are in the red, athletics are supposed to stop during the period that it takes to get back down to the yellow. But we need to be, again, very careful, especially when we are seeing the spread. And everybody who pushed for them, and I got it, made the commitment from the start that we are going to try to do best practices, we're going to try to do this, but when it proves dangerous or there is spread, we're going to stop at least for a period of time. I need people to keep their word on that, to not try to get around it, and when there is an outbreak, do the right thing. I will tell you, everybody we know that has had one has done the right thing. So we just need to keep that up. I thought that there was a quick and positive reaction here in Franklin County by Franklin County Public Schools, and we appreciate that form of leadership. But these are our kids. Let's be careful. Let's watch this, and let's make sure that we are being attentive to what's happening, and that we are willing to reevaluate when needed. Let me also be clear, because this can stir people up, there's no overall reevaluation that's occurring. Again, my job is to flag when we see things that we ought to be watching, and that's what I'm doing here today. All right, today's COVID update, 824 new positive cases. And that's 824 out of about 10,000 new tests. And so what does that do? That increases our positivity rate. So not only do we have more cases than I'd like today, 824, 134 are kids under 18, but our positivity rate is now back over 4 at 4.52%. Total cases now 62,731. And today we are reporting 7 new deaths to bring our total to 1,119. They include a 79-year-old man from Jefferson, a 79-year-old man from McCracken, a 69-year-old woman from McCracken, a 90-year-old man from McCracken, a 56-year-old woman from Marion, an 87-year-old man from Hardin, and a 92-year-old man from Taylor counties. Let's light our homes up green for these 7 families. Let's ring our bells every morning at 10 a.m. To the families, it doesn't matter when during this virus their family members passed away. It hurts just the same. So let's make sure we show them the respect we have for everybody else. Currently, Kentuckians in the hospital for COVID-19, 511, 133 in the ICU, 73 on a ventilator. New cases by county, Jefferson, 129, Fayette, 110, Christian, 78. That is a lot of cases. I think the most we've seen in one day, at least in Christian County. Madison, 37, Warren, 35, Laurel, 28, Hardin, 24, Boone and Whitley, 18, Davis and Montgomery, 13, Campbell, Clay, Henderson, and Muhlenberg with 12. And you notice Clay was in the red, and then we have 12 today. That's not a mistake, because when there is widespread community spread, when there is significant community spread, you're going to see in the next couple days that those red counties also report double-digit cases, even if they are a small county. Callaway, Kenton, and Oldham all at 11, Union at 10. Whole lot of other counties. They are up on the website so that people can see them. Long-term care is the only specific area we're going to update today. There are increases, but small increases in the others. 31 new residents, 50 new staff, 4 new deaths attributable to this setting. One less facility, actually, that has had one positive case. That sometimes happens with reporting. So a tough day. We'll see what the rest of the week holds. But I think we can all admit as we look around that maybe we're not doing things as well as we were 3 weeks ago or 4 weeks ago. And given that we're going to be taking steps about getting kids back in school in areas where there is not that level of community spread, given that we want sports to continue and we're seeing teams with positive tests, we got to redouble those efforts, because the future of our economy, whether we can keep things open, doesn't depend on me. It depends on how we respond to the virus. Whether it's safe for our kids to be in school doesn't depend on me. It depends on the virus. The number of lives lost depends on the virus. And what we can do to stop the virus, it's fundamental, it's easy. It's wearing a mask, it's social distancing, it's limiting your contacts. That helps us do everything else out there. It's also your patriotic duty as an American and as a Kentuckian. This is our challenge. In many ways, this is our war. We've lost 200,000 people. I think it's fair to talk about it that way. And we need your help, because your actions are what can save someone or cause us to lose them. And you might not ever even know. So with that, we will open it up to questions. I don't think I've missed anything. Let me just start out with one question I know that's out there that's about Halloween. We don't have our guidance ready yet. So Ohio had put out some guidance that we were at least looking at that talked about ways to do it. The CDC put something out saying, don't let kids trick or treat. Now, I believe our guidance is going to try to provide a way for kids to have that experience, but in the safest way possible. But let me be clear, the idea of big parties for young adults or older adults, no. We cannot do that during Halloween this year. So let's focus on trying to find a way to make sure kids can have a safe experience. But that also means, that traditional walking around with 7 other adults while the kids are running around together. We're probably not going to be able to do that either. So to do it safe is going to require a lot of supervision. Going to require you protecting your kids and everybody else's based on your actions. All right, we'll open it up to questions. We'll go Joe and then across. I have not signed an authorization or an activation for the National Guard to engage in any mission as I'm standing here today.
So people in Louisville are right now, the shut down. Are you clear at all on what is your understanding of when the decision is going to be released? Do you have any clarity on that?
I cannot comment on when a decision related to the Breonna Taylor investigation is going to be released. I know that the city of Louisville has declared their state of emergency, and so folks from that believe it's coming soon. I think that's fairly reasonable from seeing the state of emergency, but I can't provide specific comments on timing. Tom?
So have you been in touch with Attorney General Cameron at all on this?
We have had communications with the Attorney General's office. We have appreciated those communications, but I cannot comment on them. That's part of the trust in something like this that we have to have.
How do you think organizers, protesters should take seeing all those preparations, the barricades, boarded up buildings in Louisville?
The question is, how do I think that, I guess, community activists and those that want change and have been out in peaceful demonstrations, how they should view what's going on. First, I think that LMPD and others are trying to ensure that any reaction is one where people can give voice, but at the same time that we don't see violence or property damage. Now, just about every protest, other than in a couple nights that we have seen in Louisville, hasn't had those, but the national attention here is so great, the potential for outsiders so significant, the possibility of someone taking something peaceful and trying to turn it into something that's not is all there. I mean, when we saw a couple weeks ago a couple groups coming together in downtown, one being the Three Percenters, a white militia group that I think is a white supremacist militia group. I know them fairly well. They came over to my house and they hung me an effigy. I think that people can see the potential presence of groups like that and understanding wanting some level of security. I want people to be able to give voice to frustrations. I hope they can find a way to do it where they feel heard, but at the same time can't potentially turn something that can be positive into something that can be negative. And I've talked to a number of organizers, and they've said the same, that the eyes and ears of the world are going to be here. People are going to be heard. Let's just make sure it's done in a way to where that message doesn't get lost. Yeah, the question is on high school sports, which we talked about, when college sports or professional sports have a ton more resources. College sports in the SEC, they're going to test athletes 3 times a week. And right now, I don't think there's a requirement that our high school athletes are tested even once a week. Certainly, if I was running a high school program, which I'm not, I'm a little busy, but I'm also not qualified to run a high school sports program. That's because of lack of overall talent. I would want my team to be getting tested on some basis. I would really want to talk about a partnership with my parents about ensuring that I always know how my athletes are feeling. I'd want to make sure I communicated to them that their health is most important to me, because their futures are big and bright, whether they include athletics or not, and if I was a coach, would be in an almost sacred position to make sure that we protect that. And so talking to them too about how if you feel bad, you really need to talk about it. Don't try to come to a practice just because either it's your senior year or we really need you. I think that dialogue needs to be there. And then I think we also need to be clear that when there are schools that are in red zone areas, we ought to not want to play that game, even if we're somewhere else that week, and that's tough. There's a lot of anticipation, and people look forward to it. But I think that communication and just being really clear on the expectations, putting the student athlete first, which means their health and their future is where I would be. I would look at some form of testing and monitoring, and that can be different in different places, but especially a high contact sport is important. We see things we've seen at different times, football, soccer, I think there were just a couple teams, and volleyball in particular, we've seen some outbreaks in.
Do you plan on activating, authorizing the National Guard or Kentucky State Police today, tomorrow?
We have certainly had requests for assistance from the state police or the National Guard, either once a decision is made or if certain events occur. We're going to make sure that we make the right decision to secure the personal safety of everybody, protect critical infrastructure, and so I think that there can be an expectation that the Guard and the Kentucky State Police will serve limited, specific missions where they will be under their own command, meaning the Guard or the State Police, and that LMPD will be the primary law enforcement unit that will interact with any demonstrators, but there are specific missions whereby the Kentucky State Police or the National Guard could help.
Have you been given any assurances by the Attorney General's office that the final decision on the Breonna Taylor investigation will come before the end of this week, or might it go into next week?
Again, I can't comment on the timing of an announcement, but I haven't been told when an announcement will occur. We thankfully are communicating with the AG's office to some degree, but I can stand up here and tell you I have not been told personally that it's coming at this time or at that time. That doesn't mean that I'm not trying to get information, which again I'm not going to comment on, so that I can do my job to the best of my ability.
Governor, you may recall that a month or so ago, the President put federal agents into some cities that were being beset by violence, if you will. Have you had any communication on with the Trump administration that they may want to do the same here?
The question is about federal agents in other cities. Have I had a communication with the Trump administration about whether we'd see that here? I have had no communication on this with the Trump administration. Now, we have certain federal buildings in Jefferson County. I would expect, in the very least, for security in those buildings, that you would have federal agents. So that's natural. We want to make sure that any demonstrations, if they occur, are peaceful, that people are treated with dignity and respect, and in part of that there is good communication between any law enforcement agencies that are out there at any time. We never want misunderstandings to lead to bad results, and the goal here, and I know people will feel differently about it, is just to make sure everybody's safe. And I mean that is everybody, absolutely everybody. I'm committed to change. I'm committed to addressing systematic racism in ways that I can. I'm committed to listening, knowing that I'll never be able to directly feel that impact. And I hope that the people believe and work with me, even if we have to take some steps that are intended to protect everybody's safety, and we mean that. But that takes a little bit of trust. And I know right now that's a hard thing, especially with frustration and emotion to a degree. Again, it's hard for me to comprehend, but I can try to hear and try to do better moving forward.
What's the latest on the state's preparations for vaccine distribution, and has there been any more guidance from the CDC?
So we have received some initial guidance on vaccine. The question is on vaccine distributions. We are working to create our own plans right now. We have a group that does that. We actually had a discussion right before I came out here about what we want to do with that group. Do we want to add to it? When we look at all the different steps, first, the first is what will we get and when will we get it? But then you got to think about storage, physical distribution, the fact that it's going to be 2 separate shots over, I think, 21 days that has to be from the same manufacturer when there might be 3 or 4 different vaccines. That means it's probably the same provider, whoever they are, giving them to you. Then there's priority about where we go and how we go, those that are most at risk. There's the overall safety that we're going to have to assure the Kentuckians about. Just because we receive a shipment doesn't mean we're going to start vaccinating people if we don't believe it's safe, and if I'm not willing to stand up here and either take it myself or tell you I'm going to take it. So there's a lot of moving pieces in it. And then there's also on the back end, as we're able to start opening things up, those that are vaccinated are going to be better protected. And how do we deal with that as we move? So if I say it's a challenge, and it really is, we got to, hopefully there's 4.4 million Kentuckians who want to get vaccinated when they know it's safe. And we got to figure out the when and the how to do that. But that's a challenge I really look forward to. And that's one that we're going to get done. We're going to rise to the occasion. I have full confidence that once we know a vaccine is safe, that we will distribute it in a really organized way that prioritizes those that might be harmed first or those that are on the front lines. And we're going to communicate exactly how we're going to do it and be transparent about it.
So several weeks after you announced the contract extension with Ernst & Young, you said they were going to be focusing on about 70,000 unemployment claims that were left. Do you have any update on that number, or if you're headway, or how that's going?
I think we do. Oh, actually, I got another piece of news for you on that topic. At this time, Kentucky has been approved by FEMA for an additional 3 weeks of the additional unemployment payments. Eligible Kentuckians will now be able to receive $400 for the weeks of August 22nd, 29th, and September 5th for each week a claimant meets the criteria. That means individuals who qualify for a weekly benefit of at least $100 per week in UI compensation for each week covered by FEMA's what they call LWA, Lost Wages Assistance, and individuals who self-certified that their employment has been impacted by COVID-19. Payments are going to be automatically processed and we'll have a timetable soon, but understand that because of the federal government, we don't get to control exactly how they go out. The first 3 weeks went out in 3 different batches. You receive different payments. That's how the federal government has set it up. I have a question here of why can't you just send everybody a lump sum payment of $1,200 if they qualify? Well, we don't get to choose that. And if you've ever dealt with bureaucracy, you know that if they say, we'll do it in 3, but we'll get it all out, you say, okay, and you make it happen. And so we had, I think, a 24-hour delay or so with one of the sets of payments that went out on the initial 3 extra weeks. We have resolved that, so we are back on track, and most people should have seen those payments by now. We will get a timetable for this, but it will be done automatically based on that criteria. And this is a win-win. It's a win for those that have been struggling to get those extra dollars in. It's also a win for our state because it continues consumer confidence. We see the money cycle through our economy, especially retailers and others that have been struggling, and then it ends up coming back to the state. Any overpayments to people, we've actually got a way on future payments to debit that as it comes in, and so there's a big system there where we're going to make sure that those that are overpaid as they need payments in the future, that we resolve and get it right. Now we can get you the overall numbers, but we have been making really good progress. Our pace on the 2-page letters for those that are still waiting, and we have to give what's almost a court ruling, except it's from the administration, has picked up significantly every day. I remember when we hit quadruple digits, meaning we were doing over 1,000 a day, is when we knew things would really start moving. Beyond that, though, there are still so many claims filed per day. We're always still fighting to make sure we can catch up. We got a little early today, and I know there's a lot going on, so if we want to do one more round. Joe? Okay.
Any additional precautions being taken here at the Capitol in anticipation of a decision by the Attorney General in the Breonna Taylor case?
The question is any additional precautions at the Capitol in anticipation of any decision. I know that any time that any news is going to come out, they take additional precautions around me. I've stopped asking about that, but that's just what we see. No, and what they, on anything, and remember we deal with protests of all types here in the Capitol. I sneeze and 14 people show up who are opposed to it. And so they track those things as they might happen in real time and adjust. Our state police does a really good job. There's a post right here in Frankfurt. So they're always ready when needed. Now everything we've had in Frankfurt, aside from that white supremacy group, has been pretty peaceful. And theirs, other than marching up on the porch and demanding I come out heckling me and that otherwise, yeah. That one, at least, everybody went home.
Did you request from the AG's office some type of 24-hour or other time period heads up when they are going to make a decision? Did they agree to anything like that?
The question is, did I request any specific heads up from the AG's office and time period? I do think I said several days ago that I requested a 48-hour notice. But I don't have any additional comments on our discussions since. Again, I have not been told exactly when any decision may occur, but we do appreciate communications that the AG's office has had to help me do my job. But you know that involves some trust, and I'm not going to overstep those bounds. We didn't have a specific agreement on the number of days notice, but again, we have communication with them, and I appreciate that. They are communicating. Tom?
Early in the pandemic, you expanded Medicaid coverage and EBT and different things along those lines. What is the status of those? Because weren't they expiring at the end of September or something like that?
We'll give an update tomorrow and go in depth on pandemic Medicaid and EBT. I will tell you that we've had real success stories in taking care of people on food and making sure they have enough to eat, and on being able to go see a doctor. While we wish we would have done better in certain other areas, I believe when you look at all of it together and everything we still have to do, Kentucky is going to compare very favorably in how we protected our people. I will tell you, yesterday was his birthday. A decision by my dad to expand Medicaid, I think, is one of the most important decisions that helped save people's lives during this pandemic. When you are number 1, 2, or 3 in heart disease, lung cancer, and diabetes, yet you have a lower death rate than many other states that don't suffer from the same health maladies or the same level of them that we do. The reason is we expanded Medicaid, we got people seeing a doctor. Healthcare saves lives, and we got to make sure everybody has it in some form or fashion.
6 months into the pandemic and reaching that 200,000 death milestone, how do you think the state response and the United States response has been to the pandemic compared to the predictions that were made back in March?
The question is 6 months in and reaching 200,000 deaths in the United States, 1,100 plus in Kentucky. How do I think the state and the federal response has been compared to different predictions? I will tell you, early on predictions, I mean, I had one model that wasn't even the worst model that showed me 80,000 Kentuckians might die. I can't describe how difficult it was to see that projection, to be making our plans and to be trying to buy PPE every day and failing, which every governor was doing, knowing that every day that passed, if that model was true, we might be losing more Kentuckians. I believe Kentuckians have done an incredible job, even based on other modeling out there. But I think while the original modeling was probably too high, it was later adjusted to be too low. And I don't know if that's because people thought that the summer would change the virus, but they changed ours to 2,000 lives, and right now we may well lose 2,000 lives if we don't buckle down, put on our masks, and do the right things. By and large, our people they have done incredible things absolutely incredible things. The right things, the wearing the mask, the social distancing, the not seeing older relatives if it would put them in harm's way, just the number of things that people have done that are so hard emotionally or financially has been nothing short of amazing. But we got to keep doing it. I mean, the number one concern I have is that we get tired, and because of that, more people die. The federal response, again, it's hard to Monday morning quarterback because it's a new virus. There are certainly a couple things that I would have liked to see done differently. How PPE was handled, testing, and maybe the example in wearing a mask. I have concern right now that the CDC's guidance is here and there and back again. But there are also a number of things that they have done very well. And in a situation like this, I don't want to be too judgmental because I think they're doing a really good job on developing the vaccine. I hope they don't push it earlier than it's safe, but I do think they're doing a good job in getting it out there. Question is, do I have any information on how a decision may be provided in the Breonna Taylor investigation? And that's something I'm not going to be able to comment on at this time. All right, everybody, stay safe, be good to each other. These are challenging times, but that doesn't mean that we can't come out of it better people. And that's regardless of the challenge that we're facing. Let's make sure that we listen to each other. We listen to the hurt that's out there, whether it's because of COVID, systematic racism, or the pain that so many others are going through. Look at this month being National Recovery Month. We can do so much better in so many different areas, and part of it is just making sure that we lead with compassion and goodness and kindness. And if we can start making our decisions there instead of judgment and anger and making other people enemies, we can be so much better. So, like every day, let's commit to it. One of the first ways we can do is put on a mask, and I'll see you tomorrow at 4.